Welcome to Health Frontiers, where we explore the uncharted territories of well-being. I am Dr. Robert Lahita, also known as Dr. Bob. With over 50 years in rheumatology and immunology and 17 years as the chair of medicine at 3 major medical centers, my mission is to simplify complex medical issues for you. Join me as we uncover the latest breakthroughs in health, answer your pressing questions, and discuss nutrition and holistic living. This podcast is all about empowering you with the knowledge and tools to manage your health effectively. Let's embark on this transformative journey together. Hello, everyone. Welcome to Health Frontiers with Dr. Bob. I'm Dr. Robert Lahita, better known as Dr. Bob, and I welcome you all today to another special show with a very, very distinguished guest today to talk about a very, very important topic. And today we're graced with Dr. Habeeb Rachman, who is an infectious disease expert and an excellent clinician, particularly a clinician teacher among physicians, young physicians and older physicians. And he is the head of infectious disease at the Hoboken University Hospital. And he's going to be with us today to address many of the questions that affect all of us and are particularly of interest to physicians, because most of the patients that come to see physicians ask these common questions about vaccination and infections. And most of you know that with the new administration that we have a new HHS director, member of the cabinet, which is coming. We don't know who that person is yet. There are a couple of candidates, but nevertheless, these are very applicable to the new administration and to the health of our nation. So, Dr. Rachman, welcome. And it's great to have you here. And I'm going to ask you a few very pertinent questions, and then we will go into talking about things like the pandemic that could be, the one that we just had, monkeypox, respiratory syncytial virus, all of these infections that you all know about, antibiotics and their use, sepsis, and then anything that we will bring up and discuss at the end of our hour. So the first question is, Dr. Rachman, what do you think about vaccines in general?
Thank you for having me here, Dr. Bob. It's a pleasure to be here. So talking about vaccines, I'm sure almost everyone has either a ring bell at home or an alarm system or a camera or something. That's like a vaccine. What are we doing with the ring bell? Anyone who comes to your door, you see who it is. Why do you want to see that? So that way you're prepared to deal with that person. Maybe it's a friend or it may be a foe. Maybe it's a burglar who's trying to take your Amazon packages or something. So you're better prepared. If you didn't have that ring bell, then people would come, steal or burgle, and you wouldn't even know until it was burgled.
Right.
So this essentially, a vaccine is such that we prepare the body exactly what the ring bell prepares for your home. Mm-hmm. It is to know what is coming. If it is coming, how to deal with it.
Right.
So, for example, the simplest concept of a vaccine is we take one body part, which is very distinguished of a virus, be it COVID, be it measles, be it anything, which has a distinct fingerprint. We take that and we tell the body to be prepared to attack it. Mm-hmm. So in other words, if it's that the hand, so to speak, of that virus, we make sure that the antibody that's made is attacking that hand or whatever of that virus, and therefore deactivates that virus. And that's basically a vaccine.
Right. And we're talking, everyone out there, about the immune system. The immune system, which is one of the largest systems of the body, and it is also what I call the biological soul, because you can't live without your immune system. And what you're doing with the vaccine is basically teaching the immune system to expect an antigen or a foreign substance like a bacterium or mold, a fungus, or even a virus like COVID, for example. Okay, well, I think we can ask safely, and I know there's a lot of groups out there, a lot of groups like the Hasidic population of Jewish people, perhaps even Seventh-day Adventists, who do not believe in vaccinating children. What can you say to parents about childhood vaccines. We know they're necessary. Now there are quite a number of them that are being given to little kids, I guess from what age?
Right from birth, we start giving vaccines. So let's take an example of measles vaccine, because we have had a breakout of measles in the past several years. And the measles, for most people, it may not be a big deal. However, for certain individuals, it may have a really bad consequence, such as inflammation of the brain. That inflammation of the brain that causes encephalitis can cause brain damage for the rest of the life. And it happens maybe for every 1,000th kid who gets measles, they can get this brain damage. Are we willing to take that risk? Do I want my kid to be the 1,000th kid who gets that? Most of the time, we're not, it'll be okay, but sometimes it'll be a really, really severe consequence. And that's why we want to prevent this kind of really bad consequence. And now, just measles. What about polio? Polio, same thing. Polio can cause paralysis. And I have seen in other countries when I travel that kids are walking like on on their arms and legs as well. They had polio. So thankfully in America, we don't have polio because we had the vaccine and we took care of it.
Right. And I think what Dr. Rachman is referring to, and I mean, this was popular during the pandemic, the COVID pandemic, was that everybody's immune system is different. It's sort of like a fingerprint. And you know how we look at DNA in criminal cases and everybody's got different DNA? Well, everybody has a different immune system. And we are out there and we do not know whose immune system is going to be adversely affected by an infection, such as measles or polio. You could get a measles infection and be fine. But then again, a child can get encephalitis, which you mentioned, which is inflammation of the brain, or severe pneumonia with a bacterium that settles in the lung after the pneumonia, the viral pneumonia, and it kills your child or kills the adult. Not everybody has a great immune system, and a doctor, family physician, or internist cannot tell generally, even with blood tests, as to how effective your immune system is against a particular agent. Wouldn't you say that's for
Absolutely,
real?
that's true. That's true. People have immunological defects. We're all different.
Yes.
So our immune systems are also absolutely different.
Now, the messenger RNA vaccine, we've all heard about those, and the Pfizer, Moderna, J&J vaccines that most of us in America have received, and now around the world it has been given to people in China, in Russia, in Europe. What do you think of the messenger RNA technique? Was it a big discovery? Was it a big boom?
Absolutely, yes. So a little bit primer about messenger RNA. Messenger RNA is the messenger that comes from, so what do we make? Your cells are replicating right now, your hair is growing.
Right.
And so each of the cells have been determined by your DNA. And the DNA will tell the cell machinery to make those particular proteins that they put together and your hair grows. Or any cell in the body, for that matter, anything. So we are nothing but a bunch of proteins. So now that command is coming from the DNA. The DNA, the copy of the message is taken by messenger RNA. It'll take that message and says, okay, this is what the DNA wants the cell to do. And the cell will make that. And it's nothing but a bunch of proteins. And viruses, bacteria, everything is nothing but a bunch of proteins. So therefore, now what the mRNA vaccines do is we send a message. We don't integrate. This is a very important point, that this mRNA vaccine does not integrate into our DNA. That's a very important point.
Yes, that's been a controversy.
Yes.
People think that the messenger RNA is going to integrate in your cell and produce something terrible.
It only will copy, it'll fake the message to the cell machinery to make the proteins. And what proteins is it telling the cell machinery to make? It is telling them, make the face of COVID. That's it. We just want to recognize this particular aspect of COVID. So therefore, the immune system is being trained over and over. Like, listen, when you see this part of COVID, attack it.
That's the spike protein.
The spike protein.
Right.
The spike protein on COVID. So therefore, the body is trained now. When the real COVID comes in, it'll just go and hone in and hit a spike protein and kill that virus.
Yes.
That's all we're doing. We are basically telling our own body, by giving the vaccine, to make what looks like COVID a part of COVID. Therefore, the immune system gets trained to attack if it sees the real one.
Right.
That's it. So it doesn't integrate with the DNA.
Okay. Now, I've heard through the grapevine, through the NIH and other places, that other vaccines, such as against malaria, against certain bacteria, are also going to be messenger RNA vaccines. So any of the stuff that you hear in the media, which doesn't always fully understand what's going on, the messenger RNA vaccines are fast, very specific, you would agree, and very protective.
Yes.
So they're not dangerous. And I've read that in magazines and I've heard that on the news. And I don't think that's fair to do that. But right now with social media, you can hear just about anything, which is unfiltered, by the way.
Sure. I just want to give you an example of a virus that gets integrated into the DNA.
Yes.
Your infectious mononucleosis is a disease caused by Epstein-Barr virus. This Epstein-Barr virus can integrate with the DNA and remain in our DNAs for our entire life. And then later on, maybe 20, 30, or 40 years later, can reactivate and cause cellular proliferation and cause lymphomas. It's a well-known fact.
Yes.
And there are a lot of viruses like that. HIV also gets integrated into the DNA and hides. It's like someone who's a foreign agent comes in, runs for Congress. He makes an American passport, runs for Congress, and gets into Congress, and then gives out false things to be done, wrong things to be done.
Right.
That is like integration to DNA, like joining the Congress and from Congress issuing, doing things. That is basically what integration of DNA is. So
can we talk about the shingles virus being an integrated virus? Is that a similar example?
Yes, it can be. It can.
That's herpes zoster for
herpes
our
zoster,
audience. Yes. So that can be a virus that expresses itself under stress or with age or with immunosuppression. Immunosuppression meaning drugs that you take that tamp down your immune system and make it less active to protect you. So immunosuppression is not something we want. It has to be something you need with medication if you have certain diseases. Would you agree?
Absolutely, yes.
Great.
It goes and hides in the spinal cord, in the anterior horn cell. So when a patient has chickenpox,
yes.
So this again goes back to vaccine. If you say, okay, we don't want the vaccine, chickenpox is cool. Okay, let them get all chickenpox. Let all kids get chickenpox. What you're doing is the chickenpox will be taken care of by the kid. Most likely it will be fine. But that chickenpox virus, which is caused by varicella zoster virus, will go and hide for maybe 20, 30, 40, 50 years. It'll go and hide in the anterior horn cell in the spinal cord. It'll just hide there.
Yes.
And then it'll wake up maybe after age 50 and causes herpes zoster, shingles.
Yes. This is a very important concept.
Yes.
And I think for all of you out there viewing or hearing this, viruses that infect and then incorporate themselves into the genome, which is what DNA is, then express themselves many years later, either in a good way or in a bad way. There is no real good way that the virus expresses itself, but like lymphoma, you mentioned cancers of the lymph system, or shingles, which is extraordinarily painful, particularly in our elderly patients. Okay, this is critical. So I want to ask you, what do you think about, we were talking a little bit a while ago about COVID. What do you think about booster shots? Should everybody get a booster shot or several booster shots? What about age groups, diseases? When?
So typically the older folks should get the vaccine because our immune system needs to be boosted.
What
after
age?
60?
60 and up?
Yeah, 60 and up.
Okay.
Some people would say 65 and up. And then the other place would be, even if they're aged less than 60, if they have underlying immunological defects, or they have other comorbid conditions like diabetes, or they have renal transplant patient, or they're taking steroids. Those people again needs, because immune system is going to be suppressed by the steroids. So therefore, you need to be really vigilant in those people that they take these vaccines, booster vaccines.
Right. So this is important, and you recommend people get a booster every year or once a year, once every so many years? How do you recommend that?
Right now, because the disease is out there, so we take it every year. Maybe at some point it may disappear. We don't know. If it does, then automatically then we'll give the recommendations at that point. But right now, yes.
Okay. What about the flu vaccine? Should everyone get vaccinated for flu?
Absolutely, yes. Before COVID, that was one of the leading causes of death every year. Preventable death.
Preventable death.
Yeah, especially in older folks and people who are immune compromised.
Yeah.
So we had tens of thousands of people dying every year. So it's a preventable death. Why, when you can prevent it?
everyone is concerned right now about H5N1. I mean, there isn't a day that goes by that you don't see a report in the media about the bird flu, and it is coming up, and people are worried this is going to be a new pandemic. What's your opinion about that?
The bad part is I don't think it can be a pandemic per se, because we have good medications against the flu virus. Okay. The medication that came out maybe 25 years ago, Tamiflu.
Tamiflu, yes.
So that works against all of the flu viruses. So even there's a small difference in the flu virus, it will help against the virus. And then we also have multiple medications, not only Tamiflu. We have Soltomivir, we have Zanamivir, we have Baloxavir, which hits at different points in the treatment of flu. So yes. I don't foresee, even though it can come, but can be easily treated.
Well, that's good to know. All right. And then there's people who talk now, many of our patients are saying, oh, I got the vaccine. I'm worried about getting a condition called Guillain-Barré syndrome. Now, let me just talk about that. Guillain-Barré, some people call it Guillain-Barré, but it's Guillain-Barré. And it is usually after a respiratory viral infection. And how does it manifest? It manifests with paralysis that starts in the feet and works up until you get to other parts of the body. I have had several friends and colleagues that had Guillain-Barré disease. It is a concern, but it's very rare. Now, can you get that from a vaccine?
Anything can happen from anywhere. The primary reasoning that happens, it's unlikely. The short answer is absolutely unlikely. The reasoning that happens here is any virus, like you were talking about the viral infection that your friends had and got Guillain-Barré, either a viral infection or a diarrheal organism that causes gastroenteritis called Campylobacter jejuni. Campylobacter
jejuni.
Yes.
Okay.
It's in uncooked poultry that can happen.
From uncooked chickens.
Yes.
Or turkey.
So what happens is this organism, the antibodies, the immune system that works to kill that Campylobacter jejuni, or the viral infection that we have, whatever viral infection, that also cross-reacts something in that virus or in that Campylobacter is similar to what's there in the nerve nucleotides sequences.
Yep.
The antibodies start attacking the nerves. When they start attacking the nerves, the myelination, the covering of the nerves is gone. And therefore, what communicates our thoughts to our actions, if I want to lift my arm or whatever, is through the nerves, from my brain to the nerves to the muscles. Right. So if the nerves are shot, then they start getting weakness. That's basically what happens in Guillain-Barré syndrome, which I think is unlikely with vaccines.
Yes.
Though anything is possible.
Anything's possible. But for the most part, those of you out there who are watching, vaccines rarely, if ever, and we never say never in medicine, but they rarely cause Guillain-Barré. The infections that he's talking about, namely Campylobacter, which is mostly of the bowel, and other respiratory viral infections, can cause by and of themselves Guillain-Barré syndrome. And Guillain-Barré is usually recoverable. You usually get better from it, and it doesn't last forever. So those of you out there are concerned about having a vaccine because of the dangers, Guillain-Barré is not one of the dangers. So should everyone, well, we already talked about the boosters, but what about the shingles vaccine? Should only people who have had chickenpox get that vaccine, or should everybody?
Everybody should get the vaccine, because you never know if they had chickenpox or not in childhood. They may not have the memory. And when it comes, then they can even get chickenpox from shingles. If someone had shingles and they never had chickenpox, somebody else who's been exposed who never had chickenpox can get chickenpox from shingles.
Really?
Because essentially it's the same virus.
I see.
Remember, chickenpox is caused by varicella zoster virus. And that virus that stays and hides in the nervous system will reactivate 50 years later as shingles.
Right.
But basically are the same virus.
Right.
So this shingles vaccine will prevent even chickenpox, it's nothing but a glorified chickenpox vaccine, to be honest. That's basically what it is. That's what shingles vaccine is in older folks. So yes, so it will prevent
This is very important because people ask this all of the time. So let me ask you now a question about your thoughts about the CDC, which is the Communicable Disease Center, the National Institutes of Health, and the FDA, how they handled the pandemic. How did they handle the pandemic? Was it legit? We all know that Dr. Fauci has taken a big hit over the vaccines, over the special distancing, 6-foot distancing, over wearing the mask. We've had people criticize the NIH. They've criticized the CDC. They have criticized them, in my opinion, about things that they did not know to begin with. This was a new event, a pandemic that was the first time in almost 100 years that this had happened since the influenza pandemic of 1918. Is it fair for Congress, for the Senate, for the politicians, for the media to accuse or threaten or blame our scientific leaders in infectious disease for the recommendations that they made to mitigate the effects of the virus?
You said it right, Bob, that it was a new thing. We never knew.
Right.
So it's a uncharted territory. Under the circumstances, I think whatever was done was appropriate at that particular time. We can do Monday morning quarterbacking and say, okay, this would have been different.
Right.
But this is something to plan for the next pandemic.
Yes.
To make sure that we don't have the same mistakes. But under the circumstances, I think they did a fair, decent job.
Yes. Even though we lost a lot of people.
Yes.
But pandemics are notorious for that. A lot of people die in pandemics. I'm going to hit on one thing before we go to pandemics and discuss them. Is there any chance that vaccines cause autism in children? That is a question everybody's asking now because of Robert Kennedy, who is a potential candidate for HHS Secretary in the President's cabinet. Do you think that there is any chance that vaccines such as caused by merthiolate or a preservative in the vial that is injected into children or adults, do you think that has any role in the cause of autism?
I think it's unlikely. I think a lot of studies have debunked it, but I think every so often someone will just throw in the question again.
Yes.
And you have to answer it all over again.
Like
so
what
after
I'm
I answer
doing
it now, so someone else will ask the same thing again next year, and the year after, it's going to be forever.
Okay. So vaccine deniers, we have kind of poo-pooed them so far on this show and said, vaccine deniers, it's illogical to deny a vaccine, which is protective. Prior to vaccines, people died willy-nilly of all sorts of infections, all sorts of virus and bacterial diseases. And now we are convinced that vaccines are not only useful and necessary, but should be the subject of every family. You should have your children vaccinated, your grandparents and elderly members of the family vaccinated. They are safe, and that's where we'll leave it for our vaccine discussion. So now let's go to pandemic discussion. I know I gave Dr. Rachman a whole list of things to discuss today, and we want to cover a lot because this is in the media every day and people are really confused. And my patients ask hundreds of questions. I'm sure yours do too. And out there, all of the physicians who are watching, they have patients who ask questions. So do you believe that another pandemic is in the future of the planet? We've heard that gain of function from the Wuhan labs is now dead, and that gain of function research is not going to be supported, at least in the next few years, by our National Institutes of Health. Gain of function, do you know anything about gain of function, and what exactly is that?
So gain of function is, we take the virus, tweak it to see, okay, I'm just going to do an analogy. Okay, let's make its arm longer. Let's make its fist stronger, something like that. What will happen now? Will it hit us harder? Okay, it is hitting us harder. Okay, so what do we do to mitigate that? Can we make antibodies, designer antibodies to mitigate that? So that is basically gain of function designing to increase the virulence of the organism. That means the attacking rate. And then how can we prevent that?
I see.
So that's basically the gain of function research.
So the gain of function studies were really to boost the virus's infectivity and see how we could control infection. And somehow that got away from everybody and caused the pandemic. So The most likely agent for a future pandemic. Do you have any idea, or can you make a prediction? That's a tough question.
The bird flu is, I think, now, even though it might come in maybe other parts of the world, if they don't have the medication, I think it'll be an issue. But for us, I think we do have medicines for that. But we do have, the other thing was, I think, monkeypox. Monkeypox is not as virulent as smallpox. Monkeypox is the poorer cousin of smallpox, so to speak.
Yes.
So if monkeypox, if someone gets it, they have a 30% chance of death. Whereas with monkeypox, it varies from 3%, 1 to 3% typically, just like COVID. So it's a much poorer cousin of, and it's more, it is less, it spreads to most of the systemic movement of monkeypox is much less. It's more local. Wherever you touch, that's where that's where the lesions occur in monkeypox virus.
Yes, and it originated in Africa.
Yes.
And I understand that it was very virulent among people who are homosexual, for example, from men who have sex with men, and perhaps even women who have sex with women. But this is intimate contact spreading this monkeypox virus. Is that the way it works?
Yes. So before the monkeypox virus became famous, it was still existing, meaning in America itself, when people go to small fairs in small towns where they have wild animals, and wild animals like dogs had this monkeypox virus. People who pet the dog, and then they would develop this lesions on the hand.
Dogs,
yeah, petting wild dogs.
Wild dogs,
yeah. So that always was there. It's like, used to occur here and there. But now with this men having sex with men, that's when it became more famous. And it was a direct contact thing that happened. But still was not as there was no increased mortality, but it was bad, but not bad enough.
Okay, so it's not going to kill you,
right?
The monkeypox.
Yeah.
And I understand now that it is present in this country.
It could still kill, but the kill rate is very low.
Kill rate's very low. Thank goodness for that.
Okay.
But it's still present in this country now.
Yes.
And others have suggested that a vaccine is going to be forthcoming for the monkeypox virus. That brings up another question, and this is something that people do ask about, particularly the media. If the media is watching, this is very important. How do viruses jump species, and why do they jump species? Do you have any idea?
Sure. The virus basically wants to replicate. We consider virus as a non-living thing. Mm-hmm. It just basically latches onto our cell machinery and wants to multiply. It's nothing but a bunch of proteins. And we are full of proteins. Our whole body is basically proteins, and every single cell in our body makes proteins for whatever, to make the enzyme to digest the food that you ate, or to make the insulin. Everything is but proteins. Mm-hmm. So if you see the basic unit of building anything is a brick. You can build a hut with a brick. You can build a mansion with a brick. You can build a palace. You can build the White House with a brick. So it's all the functional unit. Yes. So these units can be, swayed to make whatever it was. And basically that's a virus. So we have that ability that the virus will borrow from us to multiply themselves. So what happens is typically these viruses that are there in birds, like geese and ducks and fowl and whatever, these viruses stay as in those birds. But when they come in contact with pigs, the receptors to latch onto when they infect the birds are kind of similar. So therefore, there'll be reorganization and say, okay, now we are in a pig. Okay, let's change ourselves to attack the pig.
Right.
So therefore, it'll cause infection of the pig. Now in the pig, because of the different receptors, and we humans have similar receptors to pig. Mm-hmm. So therefore, now it becomes easier when you come in contact with pigs. Pigs who have been in contact with birds have that virus, which is now ready to jump into humans. And once it comes to humans, it'll go from human to human. Mm-hmm. It's rare for it to go from the bird to jump to a human, but from bird to a pig to a human becomes easier.
I see. So that is the story behind, say, bats.
Right.
Or, when COVID first started, everyone was looking for the vector. Bats was one of them. Mm-hmm. The pangolin, which is a kind of an unusual animal, was another. And there were issues in the past with animals called civets, which I guess is sort of like a muskrat.
Right.
I'm not sure. But that animal also develops the virus. So in the animal kingdom, these viruses go from one species to the other, and it can be quite adventurous for the virus and eventually perhaps infecting us. And that's where I'm confused, because could you tell our audience about the animal reservoirs, namely cow's milk, which is now being discussed at length? And then people are going out there to dairy farms and testing cow's milk for the presence of virus, especially the flu, the H5N1, I believe.
Mostly, with the cow's milk, we have so many other diseases too. We have Pastorella, we have, I'm sorry, not Pastorella, but the one that we get with cheese, Listeria monocytogenes,
brucellosis, yes.
Q fever, it's
Q
already
fever.
there. Yeah,
these are all infections that we physicians know a lot about.
Yeah, if you don't pasteurize the milk, all it takes is 161 degrees for 15 seconds will destroy all these things.
Yes.
If you don't, then that's when you start getting this different diseases, and this could be a part of it as well.
Yes,
the flu virus and everything else.
Okay, and now we've been talking. Or certain people in our political system have been talking about drinking unpasteurized milk. Do you think there's a danger to drinking unpasteurized milk?
Absolutely. Absolutely.
This is something.
And only when it happens, that's when people realize. Otherwise, unless some famous person gets it, just like with COVID, I don't know if the vaccine people who didn't want the vaccine.
You can talk about that in a sec. I just want to know, though, do you think cow's milk or any kind of milk should be pasteurized?
Absolutely.
We had a child. I was in Barcelona, just as an aside, and they brought a young child in from the mountains, and he had been drinking goat's milk, and the goat's milk was not pasteurized, but it was considered by his family, and I suppose others, as being extremely healthy. Mm-hmm. Well, he developed brucellosis, and his entire spine was affected with intractable joint disease, brucella infection of the spine, of the joints. He was totally paralyzed in a very short period of time. And we saved the x-rays to show the medical students how something like this could occur. But I agree with you. Unpasteurized milk can be a reservoir, and I think that's the appropriate term, for viruses as well as bacteria like Listeria. And we've all heard of Listeria on carrots and on lettuce, especially affecting the elderly who eat these salads. They die. I mean, this is not kid stuff. This is really serious business. So milk, bottom line, should be pasteurized.
Absolutely.
So that's a big point of this
and we can see these things that we are talking about is absolutely prevalent in other countries where they don't do pasteurization. We can see those in other countries.
You can see these things happening in other countries where they don't pasteurize. We should have a special show on fluorination of water, but right now it's simply pasteurization. So we talked about monkeypox as a potential for the next. Let's talk about a virus that some people have heard about and others have not, called respiratory syncytial virus. Now, I knew about it as affecting infants and causing severe respiratory problems in the newborn. What about this virus now popping up and infecting adults? What is happening here?
We, in the last winter, we basically saw COVID, RSV, and flu, all three in the same patient.
The trifecta.
Trifecta, yeah.
In one person?
In one person, yeah. We saw.
Wow. Did the person survive?
Well, they got treated for the COVID, they got treated for the flu, and then I guess, what we have is supportive care for RSV, respiratory syncytial virus. As the name sounds, respiratory, that means it involves the lung, affects the lungs. And you rightfully noted it was basically in children, but now it's in older adults as well. We can see that. And especially in people who have had transplants, where they are on immune suppressive drugs to preserve the transplanted organ, then those are the people who get into severe RSV.
Okay, so just to make our audience clear, immunosuppressive drugs like cortisone, better known as prednisone, depomedrol, Cytoxan, which is part of chemotherapy given to a lot of people with tumors, certain kinds of immunoglobulins, etc., things that weaken the immune system are really putting people at risk for RSV and other infections.
Absolutely.
Yes. So more than children, is it is there a therapy for RSV?
Yes, there is. You have ribavirin, and there is a newer therapy which can be used as off-label. This medication came out for kids.
Yes.
However, off-label it can be used in severe cases or in adults as well. It can be used
Okay.
along with IVIG.
Well, that's good. Immunoglobulin infusions,
Yes.
which a lot of our patients get. Okay, so RSV, just give us an idea of how an adult would present with RSV.
Typically with a upper respiratory tract infection that gets worse. So usually when a patient comes with an upper respiratory tract infection, we think it's a virus. But if it's a bacteria, then we give bacterial coverage with antibiotics. And you're giving them all the big gun antibiotics, and the patient continues to get worse. That's when you suspect, oh, this could be RSV.
Yes.
And then we have panels now available in this day and age, which is phenomenal, to know these are the looking at the nucleotide sequences. It's called NAT testing. Looking for PCR assay, looking for the fragments, DNA fragments of the virus, and it can easily recognize it. And I think the commercial panel that we use is BioFire. So it gives a bunch of things, and it's very sensitive.
Okay, so let me just explain a little bit of what the doctor has just said. PCR is polymerase chain reaction, and that is a procedure that was not available 25 years ago.
Yes.
And is now available, and that's really the way we diagnose COVID in various body fluids. It's the way we diagnose a few of the other viruses. We can artificially proliferate a specific virus or bacterial fragment or anything else to look at, particularly, as he mentioned, nucleic acids like RNA, DNA. It's part of modern technology. This will ensure that the diagnosis of the virus is absolutely correct. It's called PCR. You've heard about it. You've read about it. It's something that everyone should know about. And this has been very, very useful.
Absolutely.
And I'm very happy to hear about that. The other thing I want to say and make a point of is a lot of doctors out there are using antibiotics inappropriately to treat viral infections. And we have a thing, which I'm sure in your hospital, as you're the director, antibiotic stewardship.
Yes.
Antibiotic stewardship is making sure that antibiotics are used appropriately. Well, today, everybody's talking about the microbiome, the bowel, the organisms in the bowel, which are important to inform the immune system about certain diseases, etc. So when you take an antibiotic, which is inappropriate for, say, a virus infection, because your doctor says you have a cough, you don't have a fever, but you feel miserable, he puts you on an antibiotic, or she puts you on an antibiotic, and you don't get better. So they try different antibiotics. And what happens is they wipe out the organisms in the bowel, and that causes things like something called C. diff or Clostridia difficile, which causes a severe bacteria and can actually, severe diarrhea actually, can kill you in the process of trying to make you better. So make sure you tell your doctor, are you sure you want me to take an antibiotic, and why? Is this a virus infecting me, or do I have a bacterium? If you have a bacterial infection, it's a different story. But the antivirals are specifically for certain virus infections. Very, very important. So that leads us into the antibiotics discussion about the antibiotic ingestion and the microbiome I've just mentioned. What about sepsis? Why do people die from sepsis, and what the heck is sepsis?
It's simply a dysregulation of the immune system. So when a patient is infected with, let's say, Klebsiella or E. coli or Staph aureus,
those are different bacteria.
Different bacteria.
Right.
So then the body mounts a reaction to it. When the body mounts a reaction, we have certain armamentarium, meaning we have WBCs, we have lymphocytes, we have macrophages. They're all our soldiers. You have the Delta Force and the Navy SEALs and everything else coming in. So all this will come in and then try to destroy the organism, and there'll be a collateral damage. There'll be increased vascular permeability. That means the endothelial cells, there are the blood vessels, they start leaking. And then it'll start dilating. So when they start dilating, what happens is the blood is not going to move. If you take a pipe and put water through it, you need to have a certain diameter of the pipe for the water to flow. If you put a trickle of water and then dilate the pipe, the trickle is not going to flow.
Right. Right. So
But if
that's
it's
how
a straw, it's going to flow. If it's a straw, little amount of whatever it is, it'll still flow.
and that's why you drop your blood pressure and
Exactly.
you die in shock.
Yeah.
So there's a thing called septic shock.
Exactly.
Yes.
So what happens is when most of our blood flow that goes from the arteries like our Route 80 highway.
Yep.
So that's the artery. If there's 1 mile of artery in, for example, we have 1,000 miles of capillaries. Capillaries are the streets in a town.
Right.
So if the capillaries,
blood
that's
vessels.
where all the cells are. That's where all the homes are. So
Right.
if something has to be delivered from the highway to the homes, it has to come to the highway and then goes to a straight route and then goes to the little streets and get to the home, so to speak. So the home, if the home is a cell, we have trillions of cells in the human body. Every single cell has to get its share of oxygen and glucose. Because the very essence of living is that glucose, the carbs coming in together with oxygen to make energy. If we stop doing that, that organism dies, that cell dies, the person dies.
Right.
So now when the vessels, the capillaries get dilated, all the blood pools there. Blood is not moving, it just pooled in one area of the body, that is in the capillaries. So blood is not there in the arteries to come by.
Right.
So therefore, if the blood is not reaching the cells, the glucose is not reaching the cells, and the oxygen is not reaching the cells, and the cells will become hypoxic. They're like, oh, how do you make energy? So they default to a anaerobic glycolysis, which is, all right, I'm not getting oxygen. Okay, you know what? I have a faulty of making ATP, that is the energy system, which is converting the glucose to lactic acid. So when it makes lactic acid, it gets $2. It makes 2 ATPs. Whereas if it went through the oxygen system, it makes $36. So it's a very inefficient system to make $2. So therefore, it has to make more, $2 more and $2 more. So it'll start making lactic acid.
Right.
And that predicts us and say, oh, this patient made so much lactic acid, that means they don't have oxygen.
Right.
That means if they cross a certain threshold of more than 4 in the blood, they're most likely to die because that cell is so hypoxic, so deprived of oxygen that that cell can die. And that is basically septic shock.
And we see septic shock now, and hospitals, to their credit, have special groups that treat septic shock and also alarms when certain criteria within the hospital are met for septic shock. An alarm goes out and a team goes and tries to save the patient. And that all began from a young boy in New York City, I think it was at Bellevue Hospital, who had a strep infection and went home and it was treated, and he really developed sepsis and died. He died before his parents could get him back to the hospital. Really? I believe that's the story.
Yes.
And
that happened 7 years ago.
Yes, and because of that, our whole approach to septic shock with bacteria has that. And this is a bacterial thing. It's not, doesn't occur with viruses, or does it?
It could, like in COVID, we saw the cytokine release syndrome that happened, where suddenly there'll be a huge amount of cytokines released, and suddenly the blood pressure drops and patient dies. And that's, we had a lot of that during the COVID thing as well. But mostly it's bacterial. Right. But can happen with certain viruses like COVID also.
And cytokines, for those of you who don't know what that is, those are molecules that allow cells to talk to each other. There are cytokines, or about 200 cytokines in the body. And cyto means cell, and kine means energy. And so it's cellular energy from communication molecules that are very, very important. And we can have an entire program on cytokines. I think we're winding up here, and I really want to ask you about your thoughts about the mask, the distancing, and the vaccine. And you personally have heard of many individuals who have not been vaccinated, anti-vaxxers, who went on to die of disease because they did not take the vaccine. Is that true?
That's absolutely true. I think typically a human being wants to see proof. Right. If they see someone hitting someone and they died, they say, oh, someone hit someone and they died. They saw it, they witnessed it, so they say it's true.
Right.
But the virus, if it comes and does the same thing in the body, they didn't see it. They're like, oh, the person was walking and they dropped dead, must be something, I don't know what happened. I don't think it's a virus. So when a belief system comes in, there is no antidote to a belief. So people want to see proof. So I guess some Radio Talk hosts, I think one is, can I take names?
Yeah, sure.
Okay. He was a famous Radio Talk host in South Florida. Yeah. His name was Dick Farrell.
Right.
And he had a couple of 100,000 listeners to his radio show.
Yep. And who may be listening to this show.
Not him anymore.
No, not him. Well,
so what happened was
a tragedy.
Yeah, it's absolutely a tragedy. So he said, oh, it's a scam. He called it a scandemic.
a scandemic. He actually called it a scandemic.
Yeah, it's a scandemic. It's a lie. I don't think it's true. And then when he said that, then about 3 months later, so he was not distancing himself, nothing. He said, it doesn't exist. That's all fake.
He wouldn't wear a mask.
He wouldn't
get
wear a mask.
Vaccinated.
Yeah.
Didn't do the 6-foot distancing.
And then he got it. And then he got admitted to the hospital. And when he was really sick, that's when he said, I wish I had taken the vaccine.
Wow.
By that time, it was too late. He died.
Did he say that publicly?
He said that to his close aide who was coming to visit him and said, please take the vaccine. I wish I had taken the vaccine. So he died. And then a bunch of other people like that. Then you have Phil Valentine, who did the same thing. Yes. And then we had Herman Cain.
Yes. He ran for president.
Yeah, he ran for the presidency in Tulsa, Oklahoma. He openly said, this is basically a scam, whatever. And he got infected right in that rally.
Yes.
And 2 weeks later, he was suffering with symptoms, ended up in the hospital, died 3 weeks later, within 1 month after being in that rally.
Yes.
Then we had there are many, many more, but I'll just tell you one final one, which is a trooper in Washington State.
A
state trooper. So when the governor there said, everyone should get the vaccine, he resigned. And he made a very famous call on the radio as he resigned. He said, Governor, kiss my behind, I'm resigning. I'm not going to take the shot. And that was a famous thing. It came in news media. And then he became famous. So he went everywhere. It's like, nothing has happened to me. This is also fake. And he was, at some point, within the next 2 months, he caught it.
He caught the virus.
He caught the virus. And then he got sick and he died.
And he died.
Absolutely died.
So there are numerous examples of people who have not been vaccinated and unfortunately, and famous people. And we know hundreds, if not thousands, of non-famous people who succumbed to the disease.
Yes.
One thing we can be certain is that if you're not vaccinated and you get COVID, even the Omicron variant, which is very mild, and almost everybody in the country, if not in the world, has received or had COVID at some point.
Yep.
If you get it and you have that particular immune system, which is really liable to succumb to this infection, you'll wind up in the intensive care unit because 60% of the people in the ICU are not vaccinated. 80% of the people over, say, age 65 get severe COVID if they have not been vaccinated. And of course, we're using drugs like Paxlovid, which is a real find. And your doctor may prescribe that. And by all means, do take that. It gets rid of a lot of the bad symptoms. So the fact that the Omicron virus is very genteel and a variant that's different from the Delta variant initially, which killed over 1.5 million people in the United States, this variant can still kill you. The bottom line. Or it can still cause, we started the show with long COVID, and I guess we're going to end the show with long COVID. And Dr. Rachman, I want to thank you for being a wonderful guest and explaining so much for our audience. And I'm sure all of you out there feel the same way. If it wasn't clear before, it should be clear now. And I welcome your questions. There will be our email on the screen if you're watching this show, where you can actually send questions to us, and we will endeavor to answer them in subsequent programs. So again, Dr. Rachman, thank you very much for joining us today. And I want to thank our producer and technicians and everybody else that's involved in the production of this show, Health Frontiers with Dr. Bob. Thank you. Thank you for joining us on Health Frontiers. I hope today's episode provided valuable insights into your well-being. Remember, this podcast is not a substitute for professional medical advice, but a source of knowledge and guidance. If you have any questions or topics you'd like us to cover, please reach out. Make sure to like, subscribe, and visit our website at www.healthfrontierspod.com. Join us next time as we continue our quest to uncover the latest in health and wellness. Stay healthy and empowered. Until next time, I'm Dr. Bob.